Hi, good morning. My name is Hui Ting and welcome to the PEC talk show. Today the topic is about visual impairment. So the definition of visual impairment is it includes blindness and it means impairment in vision that even with corrections such as glasses and contact lens, it will still adversely affect a child's educational performance. And it also includes both partial sight and blindness. So today I've invited two guest speakers who will share more about visual impairment with you guys. And here with me is Dr. Sujin, who is an eye specialist, and here is Edwina Chong, who works closely with the Blind Association. So Dr. Sujin, can you share with us about the causes of visual impairments? So there are three main causes for visual impairment. The first cause of visual impairment is refractive errors. For people with normal vision, refraction causes a clear image falling directly on the retina. However, for people who experience refractive errors, the size and shape of the eye prevent the light ray from focusing on the retina, so it results in like the blur image form. Okay, so Miss Edwina, can you share with us what causes your blindness?
So when I was 15, I experienced blurred vision. My parents then brought me to see an eye specialist and he told me that I have cataract, which is a structural impairment. So according to him, cataract is a cloudiness on the lens of the eyes, which blocks the necessary light from seeing clearly. So in the Blind Association, I have also interacted with people with structural impairment, which are caused by malfunction of one or more parts of the eye's optical or muscular system.
Okay, so Dr. Sujin, just now you mentioned there's three causes of visual impairment. So what is the last one? So the last main cause of visual impairment is the cortical visual impairment, which is associated with brain damage, and also the external eye problem, growth, thinning or inflammation of the cornea also cause visual impairment. So we have come to the end of the session. Thank you for sharing with us. I hope you all learned something today and have a nice day. Bye! Hi, my name is Hui Ting and I've learned the definition as well as the different causes such as cloudy visions that leads to visual impairment. Hi, I'm Sujin and I've learned more about visual impairments and the different factors that will cause them to happen.
Hi, I'm Edwina and I've learned that there are different causes that leads to visual impairment, which results in blindness, blurred vision, and many more.
Educational placement of children who are visually impaired.
The definition of educational placement is a setting in which educational services are delivered to students. There are two categories of educational placement in Singapore: mainstream and special education schools. Special education schools offer both mainstream and specialized curriculum. Special curriculum caters to the needs of students with different types of disabilities.
There are a variety of ways to assess the severity of a child's visual impairment. Measures of visual acuity, eye preference, color vision, visual fields, visual discrimination, depth perception, contrast sensitivity, reading rate and comprehension, learning media assessments, and expanded core curriculum checklists are all ways to assess the type of intervention required by each child. Once a child has been identified as a viable candidate for intervention, they will be referred to specialists and special schools, and parents will be given information about the process so that they can be involved in the process as well. Children with a visual impairment will go through occupational therapy, and Braille is a way for them to read with a sense of touch. Early intervention programs for infants and children, or more commonly known as EPIC, provides therapy and educational support for infants and young children below 6 years old diagnosed with special needs, and equips them with necessary skills and helps them to develop their potential. As parents play a crucial role in their child's life, they will be given training so that they are equipped with the necessary knowledge of how to support their child throughout this process.
At 7 years old, children will be placed in either mainstream primary schools or special education schools depending on the severity of their impairment. Lighthouse School is a special school that provides education to children with visual impairment, children with hearing impairment, and children with autism.
At 13, these children will again be placed in a mainstream secondary school or a special school depending on the type of support they require to perform academically. After they have graduated, they may proceed into the working world as independent individuals, equipped with skills that they would require to support themselves. Here's what we think about the education process for children with visual impairments. Laurel thinks that it is a good process as both parents and children are given a direction to move in academically. Holly also thinks that it is a good process. However, she feels that more could be done to help the children to meet their specific needs. Ziying thinks that it is a good process as well, as it provides information for parents to better know their child's condition, thereafter putting their child in a suitable school. Along with the three of them, Kate thinks that it is a good process. However, it lacks attention on the individuality of each child and does not place any focus on building their talents. This is the end of our video on the educational process for the visually impaired. Thanks for watching!
Here are some strategies that can be used in the inclusive classroom. Firstly, teachers can use larger visual cues so that the children who are visually impaired can see better and clearer. Some examples will be larger font size, especially on instructions and environmental prints. Secondly, teachers can provide more sensorial materials for lesson and play. For example, felt, TV rag, scented materials, and sand and water play. Thirdly, teachers can also provide clearer verbal cues. For example, give instructions verbally, speak clearly and in a slower pace, and if possible, reduce the usage of visual cues. Here are some strategies parents can consider when taking their child out for an outing. Firstly, choose places with barrier-free roads and clear pathways. Secondly, keep the child within adult's sight and look out for the child's safety frequently. Thirdly, ask questions frequently to ensure that the child is feeling comfortable.
Today we'll be discussing the characteristics and subtypes of visual impairment. Firstly, normal vision is whereby a person is able to see a certain line on the size chart from 20 feet away without the image being blurred or distorted. Secondly, moderate visual impairment is whereby a person has mild difficulty in visualizing an object. However, the visual impairment can be corrected with the use of visual aids such as glasses.
The next subtype is severe visual impairment, whereby a person has severe difficulty or almost no ability completing any work for which eyesight is essential without using any visual aids. The final subtype is blindness, whereby a person has a total loss of useful sight, be it temporarily or permanently. Moderate visual impairment combined with severe visual impairment are grouped under the term low vision. Low vision taken together with blindness represents all visual impairment.
Most of us are familiar with visual impairments such as nearsightedness and farsightedness. However, there are also other less familiar visual impairments, which include strabismus, congenital cataracts, retinopathy of prematurity, retinitis pigmentosa, coloboma, optic nerve hypoplasia, as well as cortical visual impairment.
Some characteristics of visual impairment include physical signs, clumsiness, behavior, poor hand-eye coordination, and poor academic performance. Signs of poor hand-eye coordination might include difficulty throwing or catching a ball, tying shoelaces, or copying schoolwork from the whiteboard. Poor handwriting is also another sign of poor hand-eye coordination. A child with visual impairment might also have poor academic performance. He might not read well, might use his finger to follow along when he is reading. Some children also have trouble remembering what they have read. Children with visual problems can find it difficult to write or might have problems with math and other subjects. Schoolwork can be a challenge for a child who cannot keep clear focus and who deals with double vision and blurred print on pages.
Physical signs includes crossed eyes, eyes that turn out, eyes that flutter from side to side and up and down, eyes that do not seem to focus. Children with visual impairment may also constantly run into pins and fall down, trouble realizing how close or far away objects really are, consequently they might misjudge a distance. They may also have short attention span. Children might blink frequently or squint whenever they read or watch television. Children are sensitive to bright light or sit close to the television or hold books that are reading close to their face. Younger children with visual impairments might hold toys very close to their face too.
You can be the outcast or be the backlash of somebody's lack of love, or you can start speaking up.
Hi, good afternoon. I'm Stephanie.
I'm Valerie. Welcome to Debates in Singapore. With us today, we have a specialist. Her name is Miss Pauline Low. She's here to provide us with more information about the education for visually impaired children here in Singapore. She'll be covering about the benefits and limitations for enrolling children in either a mainstream setting or an early intervention setting.
Let's welcome Miss Low. Good afternoon, Miss Low. Thank you for taking the time to come here today. We have prepared some questions that we'd like to ask you. Firstly, can you tell us some benefits of including a visually impaired child in a mainstream setting?
Well, one benefit of placing a visually impaired child in a mainstream setting is that it provides children with appropriate peer models and opportunities to practice social skills. Secondly, a mainstream setting encourages visually impaired children to be more independent and equipped with self-management skills. Thirdly, a mainstream setting helps visually impaired children to cope in a more working setting as they have gained experiences in being integrated with sighted individuals.
So much of the benefits. Now, can you tell us some of the limitations then?
Some limitations of enrolling children in a mainstream setting includes the environmental setting. The mainstream school may not be suitable for special needs children as there may be obstructions in terms of the layout. In addition, learning materials and resources for the blind should also be limited. Also, when visually impaired children are enrolled in a mainstream school, they may encounter problems in developing social skills. Hence, they might not be able to cope emotionally, despite being able to cope academically. In the long run, children who are affected may face low self-esteem.
I see. So do you think it's better to include the child in an early intervention setting?
Special schools serve as centers of expertise and materials. Children are more likely to be exposed to positive blind role models.
Okay.
Attending these classes with visually impaired peers leads to more informal peer teaching opportunities and less of a sense of difference from peers.
I see. So together with these benefits, are there any limitations?
Teachers at special schools may not always hold high standards for the children to achieve. The environment of the specialized school does not stimulate one that the mainstream school will accommodate them after graduation.
I see. Thank you so much for your time, Ms. Low.
Thank you, Ms. Low. I have gained a lot, have you?
Yes, definitely.
I'm looking forward to more debates coming up on our debates channel.
See you next week.
Goodbye.
The way the words do when they settle beneath your skin, kept on the inside and no sunlight. Sometimes the shadow wins. But I wonder what would happen if you say what you want.